I'm a Year 12 student, and this is my research outcome on autism, and this is my presentation on autism. What is autism? As research says, autism is a spectrum disorder that is a group of development disabilities which can cause serious social, communication, and behavioral difficulties. Autism can be mild to severe, which is why it is called spectrum. Environmental contribution to autism comes from studies demonstrating the sensitivity of developing brain to external exposures such as lead, ethyl alcohol, methyl mercury. But the most powerful proof of concept evidence derives from studies specifically linking autism to exposures in early pregnancy. This is what people believed when asked what causes autism. 47% of people surveyed said it is caused by genetic and 35% said they don't know. 11% said drugs and the other 5% said other. This survey was conducted by me and the participants were the Powerfield Gardens High School students. Surveyed participants, when asked what is autism, responded 21% of participants didn't know what autism was, 0.7% said disorder, 21% said condition, and 21% said disability. 11% said learning difficulties, and 21% had other description. This survey was conducted by me and the participants were the Powerfield Garden High School students. What is autism? An estimated in 1 in 70 people has autism. That's almost 2,300 Australians. Autism affects almost 4 times as many boys than girls. From the surveyed participants in high school by me, responded 14 said autism is a lifelong development condition that affects, among other things, the way an individual relates to his or her environment and their interaction with other people. And responded 20 said there's no one type of autism but many. Autism or autism spectrum disorder refers to broad range of condition characterized by challenges with social skills, repetitive behaviors, speech and nonverbal communication. Indicators of autism usually appear by age 2 or 3. Research says the two main areas that they have difficulties around are social communication and interaction, and restricted repetitive patterns of behavior, interests, or activities. They may develop cognitive problems such as finding it hard to concentrate, solving, and executive function as well as difficulties with changes in routine and schedules. They are so used to having the same routine every day, and if one day it suddenly changes, then they won't know how to cooperate with the changes. The information found are from this source. This image shows what are the disabilities, what are how they have problems, and the source of image is here. Research says students with autism learn in various ways, and one of them is visually. By learning visually, they are able to be attracted and maintain attention, which helps the students to focus on the information, helps students to express their feelings and thoughts. However, not all students require visual support or the same level of visual support. There needs to be a structured teaching approach which requires to be clear and systematic with transparent communication and suitable visual materials. The information found are from this source. This is what people said when asked, how can autistic children perform tasks better visually or verbally? 25% said visually, 33% said help from teachers, 16% said other, and 25% said I don't know. This survey was conducted by me and the participants were the Powerfield Garden High School students. Research says one of the most researched interventions and effective therapy for autism is applied behavior analysis (ABA). ABA has been the most practiced therapy for more than 50 years, which is extremely structured, reduces problematic behavior, and comes with scientific approach that shows communication, self-care, and social living skills. In this therapy, a therapist will cut down the skills into small parts, and from repetition and assistance and encouragement, they will help the children. While observing, they will look at the abilities and determine what would benefit the children. This information found is from this source. When asked what kind of therapy would best be effective as a treatment for children with autism, responded 57% said I don't know, 14% said therapy, 7% said moderated learning, and 21% had other description. What are some challenges that autism children face around the school? When asked at the participants, they responded 27% said bullying, 27% said to fit in, 16% said learning difficulties, 5% said communication, and 22% said I don't know. The survey was conducted by me, and the participants were the Parafield Garden High School students. Research says spell is one of the main ways to understand and respond to autism spectrum. There are five principles which have been classified and are the essential components when practicing autism. The word spells stands for structure, positive, which is approaches and expectations, empathy, low arousal, and links. The source of this information can be found here. Survey participants, when asked what do you think schools are doing to help children making learning easier, responded 26% said getting help from teachers, 20% said special class, 26% said I don't know, and 26% had other description. The survey was conducted by me, and the participants were the Parafield Garden High School students. Research says some of the social interaction and that children with autism may face are some children have difficulties understanding other people. For example, they may not be able to read facial expression or body language, find it difficult to deal with conflict. For example, they may not understand the difference between being assertive and being aggressive. Some of the skills that are challenging for autistic children are social interactions such as sharing ideas, communicating, making eye contact, and making friends. The information can be found from this source. Surveyed participants, when asked, can children with autism show affection and care, responded 80% said yes, 6% said maybe, and 13% said I don't know. The survey was conducted by me, and the participants were the Parafield Garden High School students. Surveyed participants, when asked, do you think children with autism intentionally refuse to interact with people, responded 23% said yes, 38% said no, 30% said I don't know, and 7% said maybe. The survey was conducted by me, and the participants were the Parafield Garden High School students. Surveyed participants, when asked, do you think if children have the right treatment for autism, they will be able to live and grow independently in the future, responded 86% said yes, 13% said I don't know. The survey was conducted by me, and the participants were the Parafield Garden High School students. In conclusion, the information found on autism are that autism is a spectrum disorder that is a group of development disabilities. It can be caused by environmental exposures as well as exposures in early pregnancy. There are several challenges and difficulties that children face with autism, such as social interaction, learning difficulties, and communicating. However, when participants were surveyed, it can be seen that people are aware of autism spectrum. There are various treatments and therapy which are available for children to be helped, as well as the school are required to look after the children. And thank you for listening.